Hi, I'm Biddy Das, a colorectal surgeon who performs minimally invasive colorectal surgery at the Colon and Rectal Clinic of Houston, and it is my pleasure to introduce the Innovation of the Year for 2020 FLS, EzStitch Suture Ease, a port site closure system. One of the reasons that I'm a believer in EzStitch is because it's incredibly fast and efficient while being exceptionally and inherently safe and very simple to use. And I'd like to talk a little more about what EzStitch is and does. Port closure is not the sexiest topic in minimally invasive surgery, largely because when we combine minimally invasive surgery with enhanced recovery, we're seeing things that we've never seen before with traditional surgery, not only in terms of ability recovery, but how quickly our patients return to original function and homeostasis. But we're also not sexy because it's the end of the case. It should be fast, it should be efficient. You've done a very complex operation using very small instrumentation. But as you know, as a surgeon, every part of the operation has its own consequence and complication. And as a textbook picture will demonstrate, there is a substantial risk of these types of cyst cheese defects or multiple herniations, or even something more disastrous, a port site hernia in the immediate post-op period that requires you to go back for reoperation. In my own situation, as I noted, every part of the operation has a consequence. After performing a very complicated minimally invasive colostomy closure from another surgeon's Hartmann's procedure, many weeks later, I developed two port site hernias and an 8mm closure port where I used a closure device that was not the EzStitch, and a 10mm port hernia. Thankfully, these were reducible, and I did not have to take the patient back to the operating room for an obstruction or anything like that, but it's kind of an embarrassment in an older patient. And I also wonder if I had EzStitch at that time, I could have corrected this issue with secure, accurate closure. Talking about security, Suture Ease as a company has taken it upon themselves to do a deficit reduction analysis. And if we look at the needle puncture sites relative to a trocar defect, we want those to be orthogonal in the middle of that defect. And we want about an 8mm fascial gathering or an excellent fascial bite around a larger defect like a 12mm staple port. If we do that appropriately, we reduce that to about a 6mm defect with a square surface area of 28.3 square millimeters. However, just a variation by 16 degrees can change that completely. While we still keep the orthogonal nature to our port site, we actually more than double the square millimeter size of that residual deficit, making that port really inappropriately closed and not necessarily closed in any way. One of the other things that the literature tells us is that freehand closure, despite our best intentions, is not as accurate as needle-guided closure and actually demonstrates a higher complication rate due to poor port site closure. So we try to avoid that freehand technique, particularly in our deeper abdomens, and use a needle-guided closure. One of the nice things about EzStitch is it's built from the ground up to be easy and safe, in addition to being incredibly efficient. And that's because there's an easily loaded suture passer, an adjustable sealing cone that can accommodate large defects in the subcutaneous tissue, and allows continued insufflation and keeping of pneumo during the end of the case. There's an extended length guide shaft that also allows the application even in the deepest of abdomens, which is ideal for bariatric operations. And the distal chamber has an automatic suture capture, so there's no fishing around for suture. And as our detailed area demonstrates, there's a notch where you inset upon the fascial edge, so you can always guarantee yourselves an appropriate fascial bite, and the needle is continually protected, so there's never a free needle in your abdomen. As an example, I'd like you to watch this instructional video.
This is the end of a sleeve gastrectomy procedure. The specimen is placed in the bag and retrieved through the defect. Next, you will see the distal tip of the EzStitch guide coming through the distended defect. The notch is positioned against the fascia, the needle advanced, carrying the suture through the fascia and into the guide chamber, ensuring optimal safety. The suture is automatically captured upon retrieval of the needle. The other free end of the suture is then loaded into the suture passer. The EzStitch guide is then rotated 180 degrees to engage the contralateral fascia. The needle again advanced to drop off the suture in the guide chamber. The guide will then be retracted to expose both ends of the suture.
Suture Ease, the makers of EzStitch, and I also invite you to find out more. And you can contact me directly. That is my direct email, dadan.das@gmail.com, and my direct cell number, 713-907-5147. Or please join us on the web by finding us at fascialclosure.com or portsiteclosure.com. We welcome your thoughts and comments, and we invite you to try EzStitch in your own practice. Thank you.